Helicobacter pylori, the stomach dweller you should know about. Helicobacter pylori, H. pylori, is a fascinating and often misunderstood bacterium that resides in the human stomach. While many people carry it asymptomatically throughout their lives, for others, it's a significant cause of various gastrointestinal issues. Receiving a diagnosis can sometimes be a source of worry, but understanding H. pylori and its treatment options is the first step toward managing your health effectively. What is H. pylori? H. pylori is a spiral-shaped, gram-negative bacterium uniquely adapted to survive in the highly acidic environment of the stomach. Bacteria are often classified based on how their cell walls react to a special dye. Gram-negative just describes a specific type of cell wall structure H. pylori has. This detail is mainly important for doctors to know how different antibiotics might work best against it, but it doesn't mean anything specific about how it affects you. Its key to survival is the production of the enzyme urease, which neutralizes stomach acid by converting urea into ammonia and carbon dioxide. Urease is a special protein, or enzyme, that H. pylori produces. Think of it like a tiny chemical tool that allows the bacteria to make its own small, less acidic cloud around itself, protecting it from your strong stomach acid. This creates a protective, less acidic cloud around the bacteria, allowing it to burrow into the stomach's protective mucus lining. It also possesses flagella, enabling it to move within this viscous layer. Flagella are like tiny, whip-like tails that the H. pylori bacteria have. These tails help them swim and move around in the thick, sticky mucus lining of your stomach, allowing them to burrow deeper and find a protected spot. How do people get infected? H. pylori is considered contagious, primarily spreading through person-to-person contact. Contagious means it can spread from one person to another. H. pylori is typically spread through close contact, often within families. The most likely routes are oral transmission. This occurs through direct contact with saliva, such as kissing or sharing eating utensils. This means it spreads through mouth-to-mouth contact, like sharing saliva. Fecal-oral transmission. This involves contact with contaminated stool, often due to poor hand hygiene or contaminated food and water. This means it spreads when tiny amounts of stool from an infected person are somehow ingested by another, often due to poor handwashing after using the bathroom, or through contaminated food or water. Family spread is common, with infections often acquired during childhood. While direct transmission from contaminated food and water is possible, especially in areas with poor sanitation, cross-contamination from infected food handlers to raw foods, including meats like beef and raw fish such as sushi, is also a potential, albeit less common, route. Thorough cooking always eliminates the bacteria. Recognizing the symptoms. A crucial point about H. pylori is that the majority of infected individuals remain asymptomatic. However, when symptoms do arise, they are typically related to inflammation of the stomach lining, gastritis, or the formation of peptic ulcers. Gastritis simply means inflammation or irritation of the lining of your stomach. An ulcer is an open sore that forms on the inside lining of your stomach or the first part of your small intestine. It's like a painful raw spot, and H. pylori is a major cause of these. Common symptoms include burning or gnawing abdominal pain, often worse on an empty stomach. Bloating and frequent burping. Nausea and occasional vomiting. Loss of appetite and unexplained weight loss. Early satiety, feeling full quickly. Alarm symptoms necessitate immediate medical attention as they can indicate serious complications like bleeding or perforation. These are serious warning signs that need immediate medical attention. Bloody or black, tarry stools. This often means there's bleeding higher up in your digestive system, and the blood changes color as it travels through. It can look like black tar or coffee grounds. Bloody vomit or vomit resembling coffee grounds. This also indicates bleeding in your stomach or upper digestive tract. The coffee grounds appearance is due to blood mixing with stomach acid. Sudden, severe stomach pain. Difficulty swallowing. Unusual tiredness or dizziness, due to anemia. Diagnosing H. pylori. Doctors use several methods to diagnose H. pylori, broadly categorized into non-invasive and invasive tests. Non-invasive tests. Urea breath test, UBT. The patient ingests labeled urea. If H. pylori is present, its urease enzyme breaks it down, and the labeled carbon is exhaled and detected. Stool antigen test, SAT detects H. pylori proteins in a stool sample. Blood test, serology detects antibodies to H. pylori in the blood. While easy, it cannot differentiate between active and past infections, so it's not used to confirm eradication. Important note for non-invasive tests: for accurate results with urea breath tests, UBT, and stool antigen tests, SAT, it's usually necessary to stop taking proton pump inhibitors, PPIs, for at least 2 weeks before the test. PPIs can temporarily reduce the bacteria's activity, leading to a false negative result. Always follow your doctor's specific instructions regarding medication before testing. Invasive tests via endoscopy. If an upper endoscopy is performed, e.g., for alarm symptoms or other diagnostic needs, biopsies can be taken from the stomach lining. An endoscopy is a procedure where a doctor gently guides a thin, flexible tube with a tiny camera on the end down your throat, into your esophagus, stomach, and the first part of your small intestine. It allows them to visually inspect the lining. During an endoscopy, a doctor can take tiny tissue samples, called biopsies, from the stomach lining using small tools passed through the endoscope. Rapid urease test, RUT, a quick test where the biopsy changes color in the presence of H. pylori's urease. Histology, microscopic examination of the tissue to directly visualize the bacteria and assess for inflammation or other abnormalities. This means the biopsy sample is examined under a powerful microscope by a specialist, a pathologist. They look directly for the H. pylori bacteria in the tissue, as well as checking for any signs of inflammation, damage, or other changes in the stomach lining cells. Culture, growing the bacteria in a lab to test for antibiotic susceptibility. In a culture test, the bacteria from your biopsy are grown in a special dish in the lab. This allows doctors to see exactly what antibiotics will kill that specific strain of H. pylori most effectively. It helps them choose the best treatment for you if initial treatments doesn't work. PCR, polymerase chain reaction, detects H. pylori DNA and can identify antibiotic resistance. PCR is a very sensitive test that looks for the genetic material, DNA, of H. pylori in a sample. It's like finding a unique fingerprint of the bacteria. It can also tell if the bacteria have genetic changes that make them resistant to certain antibiotics. Treating H. pylori, when and how. The decision to treat H. pylori is crucial and not universally recommended for all infected individuals. For those who are asymptomatic and have no specific risk factors, treatment is generally not advised. This is primarily to curb the rising tide of antibiotic resistance and avoid unnecessary antibiotic side effects. Antibiotic resistance means that certain bacteria have learned to fight off or ignore the effects of specific antibiotics. This makes those antibiotics ineffective in killing the bacteria. It's a growing problem, which is why doctors are careful about when and how they prescribe antibiotics. However, treatment is strongly recommended in specific situations due to the known health risks. Active or history of peptic ulcer disease, PUD. Gastric mucosa-associated lymphoid tissue, MALT, lymphoma. This is a rare and specific type of lymphoma, a cancer of the immune system cells, that can develop in the stomach lining, often triggered by long-term H. pylori infection. Fortunately, treating H. pylori often leads to the regression or complete disappearance of this type of lymphoma. Increased gastric cancer risk, such as a strong family history, after gastric cancer resection, or with certain premalignant conditions, atrophic gastritis, intestinal metaplasia. Atrophic gastritis involves thinning of the stomach lining, while intestinal metaplasia means stomach lining cells have changed to resemble intestinal cells. Both can increase cancer risk. Prior to long-term NSAID use to reduce ulcer risk. NSAIDs are common pain relievers like ibuprofen, Advil, Motrin, or naproxen, Aleve. Long-term use of these medications can irritate the stomach and cause ulcers, even without H. pylori. Doctors may recommend testing and treating H. pylori if you need to take NSAIDs for a long time, to lower your risk of developing an ulcer. Unexplained iron deficiency anemia. This is a condition where your body doesn't have enough iron to make healthy red blood cells, leading to tiredness and weakness. H. pylori can sometimes cause chronic, slow bleeding in the stomach that might not be obvious but can lead to iron deficiency over time. Some cases of idiopathic thrombocytopenic purpura, ITP. ITP is a rare bleeding disorder where your immune system mistakenly attacks and destroys your platelets, which are cells that help your blood clot. While not fully understood, in some cases, treating H. pylori has been shown to improve platelet counts in people with ITP. In some patients with functional dyspepsia where other causes have been ruled out. Dyspepsia refers to persistent indigestion or stomach discomfort. Functional dyspepsia means you have these symptoms, but doctors can't find a clear physical cause, like an ulcer or gastritis, even after tests. In some of these cases, treating H. pylori can surprisingly help relieve the symptoms. Treatment typically involves a combination of medications for 10 to 14 days to maximize effectiveness and minimize resistance. Common components include antibiotics, such as amoxicillin, clarithromycin, metronidazole/tinidazole, tetracycline, or levofloxacin. The choice depends on local resistance patterns and patient allergies. It's important to know that antibiotic regimens can vary significantly depending on your geographic location, as H. pylori resistance patterns differ around the world. Your doctor will choose a regimen that is most likely to be effective in your area, sometimes using advanced testing like PCR to guide antibiotic selection. Proton pump inhibitors, PPIs, medications like omeprazole or lansoprazole that significantly reduce stomach acid. PPIs are a type of medication that are very effective at reducing the amount of acid your stomach produces. They're often called acid reducers. This is crucial because reducing stomach acid with PPIs creates a less hostile environment for the antibiotics, allowing them to work more effectively against H. pylori. PPIs also aid in the healing of any existing ulcers. Bismuth subsalicylate can be added to certain regimens, coating the stomach and having direct antibacterial effects. This is a medication that works by coating the stomach lining, which helps protect it. It also has mild antibacterial properties that can help fight H. pylori. Bismuth quadruple therapy, PPI plus bismuth plus tetracycline plus metronidazole, is often a preferred first-line option, especially where clarithromycin resistance is high. This is a specific combination of 4 medications used to treat H. pylori, a PPI, acid reducer, bismuth, which coats the stomach, and 2 different antibiotics, tetracycline and metronidazole. This combination is often very effective, especially when H. pylori in your area might be resistant to clarithromycin. Clarithromycin resistance means that the H. pylori bacteria in a particular area have become resistant to this specific antibiotic, making it less effective. Newer options like rifabutin-based therapy and potassium competitive acid blockers, PCABs, are also emerging. These are newer types of treatments that your doctor might consider, especially if older treatments haven't worked. Rifabutin-based therapy involves using a different type of antibiotic called rifabutin in combination with other drugs. PCABs are a newer class of acid-reducing medications that work in a slightly different way than PPIs, and can be very effective in lowering stomach acid. Why is it critical to complete the entire course of medication? Even if your symptoms improve, stopping antibiotics early can lead to the survival of the strongest bacteria, promoting antibiotic resistance. This means future H. pylori infections, or even other bacterial infections, could be much harder to treat. Always finish the full course as prescribed by your doctor. Using tools like pill boxes, setting phone reminders, or associating doses with daily routines can be very helpful for staying on track. Why is follow-up testing important? Follow-up testing, like a breath or stool test, is usually done after treatment to confirm successful eradication. This is vital because you might feel better even if the bacteria haven't been completely eliminated. Confirming eradication helps prevent future complications and recurrence. Blood tests are generally not used to confirm eradication as they can remain positive for a long time after the infection is gone. What if treatment doesn't work or H. pylori returns? Sometimes, the initial treatment doesn't fully eradicate the bacteria, or a reinfection might occur. If follow-up tests show H. pylori is still present, don't be discouraged. Your doctor will likely prescribe a different combination of medications, often called a second-line or rescue therapy, based on factors like previous treatments and local antibiotic resistance patterns. There are usually effective options available. Potential side effects of treatment. While treatment is effective, it can come with side effects. These are usually temporary, but it's good to be prepared. Gastrointestinal upset, nausea, stomach pain, or diarrhea are very common with antibiotic regimens. Taste disturbances. A metallic taste in the mouth is particularly common with metronidazole, and clarithromycin can also alter taste. Yeast infections. Women may experience vaginal yeast infections due to antibiotics disrupting the natural balance of beneficial bacteria. Fatigue or dizziness. Some people may feel unusually tired or dizzy. If this occurs, be cautious when driving or operating machinery. Headache, a common, mild side effect. What to do, if side effects are severe or unmanageable, or if you have concerns, do not stop your medication without talking to your doctor. They may be able to offer solutions or adjust your treatment plan. Lifestyle and dietary considerations during treatment and recovery. While there's no single H. pylori diet, some dietary adjustments can help manage symptoms, reduce stomach irritation, and support healing. Foods and habits to potentially limit/avoid, especially during treatment and if symptoms persist. Spicy foods can irritate an already inflamed stomach lining. Acidic foods, citrus fruits, lemons, oranges, grapefruits, tomatoes, and vinegar can increase stomach acid and discomfort. High-fat foods, fatty meats, fried foods, and highly processed cheeses can slow digestion and keep food in the stomach longer, potentially worsening symptoms. Caffeine, coffee, black tea, and some sodas can stimulate stomach acid production. Alcohol can irritate the stomach lining and hinder healing. Alcohol is also contraindicated with certain antibiotics, like metronidazole, so check with your doctor. Processed foods often contain additives that may irritate the stomach. Carbonated beverages can cause bloating and discomfort. Foods and habits that might be beneficial. Probiotics, found in yogurt, kefir, fermented foods like sauerkraut and kimchi, or as supplements. Probiotics are live, good bacteria and yeasts that are beneficial for your digestive health. When you take antibiotics, they can sometimes kill off good bacteria along with the bad. Taking probiotics can help replenish these beneficial bacteria, potentially reducing side effects like diarrhea and supporting your gut health. Many doctors recommend taking probiotics during the antibiotic treatment course, not just after, to help mitigate these common gastrointestinal side effects. Berries, blueberries, raspberries, strawberries, cranberries, contain polyphenol that may inhibit H. pylori adhesion. Polyphenol are natural compounds found in plants, like berries and green tea, that have antioxidant and other beneficial properties. Some research suggests they might help prevent H. pylori from sticking to the stomach lining. Broccoli sprouts and cruciferous vegetables, cabbage, cauliflower, contain sulforaphane, which has shown anti-H. pylori activity. Sulforaphane is a natural compound found in certain vegetables like broccoli sprouts. Studies suggest it might have direct antibacterial effects against H. pylori. Green tea contains catechins that may inhibit H. pylori growth. Catechins are a type of antioxidant found in green tea. They are thought to have properties that could help stop H. pylori from growing. Honey, especially Manuka honey, has natural antibacterial properties. Lean proteins, white meat, fish, eggs, low-fat cheeses, are generally easier to digest. Easily digestible carbohydrates, white rice, plain bread, and crackers may be better tolerated initially. Gradually reintroduce whole grains as tolerated. Eating habits: eat smaller, more frequent meals instead of large ones. Avoid eating several hours before bedtime. Eat slowly and chew food thoroughly. Drink fluids between meals, rather than large amounts with meals. Long-term health implications and monitoring. Successful eradication of H. pylori significantly reduces the risk of developing peptic ulcers, gastric malt lymphoma, and gastric cancer. For individuals with a strong family history of gastric cancer or those diagnosed with premalignant conditions like atrophic gastritis or intestinal metaplasia, even after successful H. pylori eradication, your gastroenterologist may recommend ongoing surveillance. Surveillance means regular checkups or tests. For some individuals at higher risk, like those with certain premalignant changes in their stomach lining or a strong family history of stomach cancer, even after H. pylori is gone, doctors might recommend periodic endoscopies to keep a close eye on their stomach lining and catch any potential problems very early. This could involve regular endoscopic examinations to monitor the stomach lining for any changes. This personalized approach helps catch any potential issues early. Preventing reinfection. While complete prevention isn't guaranteed, you can reduce your risk of reinfection. Practice excellent hand hygiene. Wash your hands thoroughly with soap and water, especially after using the bathroom and before preparing or eating food. Ensure food safety. Cook all foods thoroughly, especially meats. Avoid raw or undercooked meat and fish, as H. pylori has been detected in these foods and can be a source of infection, particularly if food handling hygiene is compromised. Be mindful of food handling practices. Drink safe water. If you travel to areas with questionable water quality, drink bottled water. Avoid sharing personal items. While not the primary route, avoiding sharing eating utensils, toothbrushes, or kissing with actively infected individuals can help. Conclusion: navigating H. pylori with confidence. While receiving a diagnosis of Helicobacter pylori may feel overwhelming at first, it's important to remember that this is a common and treatable condition. For most people, with appropriate testing and the right treatment plan, complete eradication is possible, and often leads to a significant improvement in symptoms and long-term health. Understanding your risk factors, recognizing when treatment is necessary, and completing the full course of medication are crucial steps toward healing. Just as importantly, following up with your healthcare provider ensures the infection has been fully cleared. Simple lifestyle habits, like good hand hygiene, food safety, and thoughtful dietary choices, can help prevent reinfection and support recovery. But every person's situation is unique. That's why working closely with your doctor is essential to ensure care is tailored specifically to your needs. If you suspect an H. pylori infection or have questions about treatment, don't hesitate to seek professional medical advice. You deserve a clear path forward, and with the right information, you're already well on your way.